infection, primary and secondary types of infections. It can either be primary infection. Primary infection is from the microorganism to the host, the bacteria into the host, Plasmodium parasite infecting you or the host. So that's a primary infection. Now, a second infection is saying when a host whose resistance is lower, an infection is going to lower your immune system. Okay, it's going to lower your immune system, and then you become susceptible to other infections. So a new organism may set up a new infection. That is secondary infection. Initially, we give an example. Primary infection, an individual is infected with HIV virus. So the HIV virus is going to multiply within the CD4 T cells and lower the immune system, laying grounds now for infection with other secondary or opportunistic infections, like Cryptococcus meningitis, like Pneumocystis jirovecii pneumonia, etc., etc. Okay. Okay. So next we look at infection can also be either local, systemic. So that's one classification. You can classify infection into primary or secondary. So you can also classify it into local or systemic. A local infection is limited to a defined area. Let's say it is limited to the ear or limited to the eyes. Okay. So it's limited to the heart, etc., etc. Then a systemic infection now spreads to the whole body, resulting into septicemia. We said the spread can either be direct spread or it can be hematogenous through blood, or it can be through the lymphatic system. The infection can also be acute or chronic. An acute infection appears suddenly or lasts for a short time. For example, an upper respiratory tract infection. You get a flu or flu-like illness that lasts for a short period of time, a few days, and then you get okay. Or it can be chronic. So a chronic infection may occur slowly over a long period and may last months to years. Normally, for some, of course, definition of chronic is going to vary from infection to infection. For others, they may define it as 2 weeks. For others, maybe a month. Others will be 3 months, etc., etc., to call it chronic. Or it could be iatrogenic. Iatrogenic is now induced by you, the healthcare worker. Infection resulting due to therapeutic and diagnostic procedures. For example, an individual who gets a kidney transplant and is put on immune suppressants. So this person's immune system is lowered and is susceptible to getting infected. For example, can get Kaposi sarcoma, that is iatrogenic Kaposi sarcoma, or can get infected with other infection due to a lowered immune system. Or any other procedure, maybe you're doing a procedure, you're doing a phlebotomy, and then you end up, if you don't observe proper aseptic technique, and you end up introducing microflora into blood causing systemic infection, like infective endocarditis. Okay, so we can have a nosocomial infection, nosocomial, hospital-acquired infection. It's an infection that is contracted from the environment or staff of the health facility. So the patient gets it from you, or maybe we are using contaminated instruments, or our beds are not well disinfected, and so the patient gets the nosocomial infection. So it can be spread in the hospital environment, nursing home environment, or those rehabilitation facilities for the elderly are not common here, common among the Europeans and Americans, or clinic or other clinical settings. Infection spread to the susceptible host or patient, the clinical setting, by a number of means. I've told you, it could be contaminated equipment, or it could be bed linen, or air droplets. This infection can originate from outside, from the outside environment. It can originate, well, it could have been brought in the hospital by another infected patient or a staff, okay? Or sometimes the sources cannot be determined. So that's what we call nosocomial infection. Or let's say hospital. The patient comes to the hospital and gets hospital-acquired pneumonia. So another important examinogenic concept is what we call the chain of infection. So the presence of a pathogen, if you find a pathogen in an individual anywhere in an environment, does not mean that an infection will begin. Well, you can touch a contaminated surface with an infection, but doesn't mean you'll have an infectious process beginning. So in order for the infectious disease to spread, several necessary steps must occur. And those steps are what we call the chain of infection, the chain of transmission of an infection. So if you talk about the chain, so it is interconnected, meaning if one of the links in the chain are missing, then you are going to break the spread of the infection. And this is very important in preventing infection spread by breaking the chain. So, in a chain of infection, this is like a chain, a continuous thing. One leads to another, and then the other, and then the other. These are the links. If you break one of the links, you remove the reservoir, then you are going to break or stop the transmission. If you remove the host, I don't know how you are going to remove the host. So the control measures, of course, do not target the host. Like if you say we are targeting the host, then we kill all HIV-infected patients or kill all COVID-infected patients. So the control measures always target the causative agent. Okay, maybe the reservoirs. These are very important. And then the modes of transmission. Once you terminate these, then the spread of the infection will stop. So a causative agent is a bacteria, virus, protozoa, or fungi. That's the causative agent, one of these components of the chain of transmission. So must be present. So you have a causative agent. Then you have a reservoir. Reservoir of this could be A reservoir could be actually a host, an individual, or it could be a contaminated instrument, could be any other thing. Then this organism, this causative agent, bacteria, fungi, or whatever, must enter into the susceptible host. So there must be a port of, rather, whatever you begin from, better to begin, let's say, from here. Mode of transmission could be what? Direct contact from person to person. Could be airborne, aerosols. Okay, so whatever the mode of transmission, it could be fecal-oral. One takes contaminated water. Mode of transmission. Then, whatever the mode, this causative organism must find itself within the susceptible host. So the port of entry. So the port of entry could be through a breach in the skin, could be through the mouth, or could be through any other part. Then this organism enters into a susceptible host. Within the susceptible host, of course, it will proliferate and then establish an infection, then later leading to disease, and then the process will continue. So we've talked about the causative agent. We've talked about the reservoir source, so host which allow the microorganisms to live and possibly grow and multiply. It could be human, animal, or the environment. I told you surfaces, contaminated surfaces, can all be reservoirs, like here. Okay, so cats could be reservoirs. Birds, monkeys could be reservoirs for what it is. Reptiles, etc. Then port of exit, there's a path from the organism, a path for the organism to escape from the host. Okay? It could be through blood, respiratory tract, when you cough out. It could be through urine, feces, etc., etc. So after it exits from the reservoir or from the host, it finds its way of getting transmitted. So mode of transmission can travel on their own. So organisms cannot travel on their own, so they require a carrier or a vehicle to carry them to other people, other places. So they can travel through the air. We talked about can be through from person to person, direct spread. It could be fecal-oral mode of transmission. It could be through aerosols or respiratory droplets, etc. So airborne transmission, contact transmission, so direct from person to person. Vehicle transmission, so a vehicle in this case could be water, milk, food, etc. So you're eating food which has been contaminated by these organisms. So vector transmission, like what? Plasmodium parasites, malaria, rather, mosquitoes are vectors for Plasmodium parasites. It could be placental, from mother to child, through across the placenta. Then enters into the host. Okay, so it could be similar to the port of exit. Then it finds a susceptible host and then establishes infection. Who's at risk? Staff at risk, clients at risk, the community is at risk. How does the community get at risk? Through inappropriate disposal of medical waste. The clients, through our procedures. So when you use unsterilized instruments or don't observe aseptic. How do you break the chain of infection? You've seen the interconnectedness. So when you remove one of those components or the links, then you break the chain and then you stop transmission of the infection. So as a health professional, or as health professionals, we cannot provide healthcare services without exposure to potential infectious materials. But we can prevent their transmission by breaking the chain of transmission of those infections. So those they are IPCs. So we follow the infection prevention and control measures in order to prevent those. So among them, you identify rapid and accurate identification of the microorganism through what? Do cultures. And so you do these swabs and then you do culture and sensitivity to know the exact microorganism that is present. Okay, so if we know the exact microorganisms, then you can target your treatment, or we can know in this hospital which type of microorganisms do we have, and so which type of antibiotics do we need to use. So we can also control or eliminate the infectious agents through what? Proper cleaning by water and mechanical action with or without detergent. So proper cleaning the surfaces, decontamination. If you see the instruments are soiled, then you remove that physical soiling. We can also do what? We can do disinfection, sterilization. What's the difference between disinfection and sterilization? Difference between disinfection and sterilization?
Disinfection kills
the
microorganisms only. But sterilization kills the microorganisms and the endospores.
Yes, so the difference with disinfection and sterilization, disinfection, you're going to eliminate or kill or remove most of the microorganisms, apart from the spores or the endospores. But the sterilization, all the microorganisms plus the spores. What are spores? Spores are what are spores? If I may ask. So spores are those dormant, so they may be dormant forms of, I don't want to call them cells or what, but they're dormant forms of the bacteria or fungi, which are normally resistant to disinfection. And they can survive very harsh conditions. So they can stay for long periods of time, actually for years, or on surfaces or on articles, and they are resistant to disinfection. So they can remain viable for long periods of time or extended periods of time. That is disinfection. Disinfection, you killing most of microorganisms, binders, apart from the endospores. The sterilization, all of them plus endospores. So under high level disinfection, you can use glutaraldehyde or Cidex 2%, sodium hypochlorite 1%, carbolic solution, bleaching powder or jig. Low level disinfection, you can use 70% alcohol, betadine solution, or Aviron. You are very familiar with these solutions. You can also have measures to control or elimination of the reservoir of the infection. So the reservoir, if they are monkeys, how are we going to? We need to control them. We may not eliminate them, but we control them. Bats, we control them. So immunization of health personnel, for example, from hepatitis B, okay, for health workers, since you are at risk. If there's a vaccine for HIV, then we shall take it on. Regular checkup for early detection of any communicable disease. Restriction from work of patient contact when infected with communicable disease. So if a patient has a communicable disease like Ebola and your contact, take you into isolation. We clean with hospital approved clear disinfectant, e.g. phenol. So we clean beds if within the hospital. So we must clean bed and then the other bedside equipment. Actually, most of those bedside equipments become very contaminated. So those bedside tables and what within the hospital, they may not be disinfected well. So they need to be cleaned before we admit. So when one patient leaves the bed must be cleaned and then disinfected before we admit another. Use separate mops for cleaning of unit. So twice a day. But sometimes you use a mop in one room, maybe having very high infectious patients, and you go and use it in another room. We do damp dusting, then drains should be patent. Drains where our water is flowing. Should be flowing, patent. Handling of linen, how do we handle linen, beds and bed sheets and all these? Keep the bed sheets dry and clean. Sheets every day, which is not ideal in most of the cases, especially in our resource limited settings. Do not shake blankets and linen the way we do at home, because you'll be spreading the germs. Do not throw them on the floor. Soiled linen should be done in separate. If you are counting the soiled linen, you should do them in a separate place, not next to the other. Pest control. So these are measures to avoid their entry into the into the unit rather, e.g. proper cleaning. You properly clean your stores, properly clean the wards, sealing, and then cleaning in order to prevent these pests from entering. Like what? It's like rats. Some of them may carry microorganisms. That should be kept, food should be kept in covered containers to avoid contamination. Fly trappers on each side of the patient's bed. Side spray should be used weekly. It's not ideal for us. Then visitor controls should restrict access to the wards or to our patients, except for doctors, nurses, and supportive staff who are going to clean or do it. Allow only one attendant in about 3 to 4 hours. You keep the doors and windows closed. Mobile phones, actually. Go to the toilet, go everywhere, you start touching patient without washing your hands. Our phones are potential sources or reservoirs of the infection. X-rays machines, echoes, ultrasound, from outside should be cleaned with spirit before they are used. Then how do we break the chain free of infection? That is the prerequisite. You practice aseptic precautions. You avoid talking directly into the client's mouth, prevent the droplet infection. So you talk from afar. Put on a mask. Carefully handle waste like urine, feces, vomiters, and blood. Then you properly dispose gloves. So chain 4, mode of transmission, is now we practice contact precautions. If the patient is high, you know, they are highly infectious, of course, you put them in isolation. Single patient room. Perform hand hygiene. Put on gowns, aprons, proper protective gear. Remove gowns and aprons and gloves. Then you perform hand hygiene after leaving the room. Before, after leaving the room. Clean and disinfect non-disposable equipment. It's advisable to use disposable equipment, but if they are not disposable, then you have to clean and disinfect. So this is droplet precautions. Where are we? For droplets, patients still, if they are in a single patient, of course, infectious patients should be in their single rooms. Staff should put on masks when entering and remove and dispose it when leaving. So instruct patients about respiratory hygiene and cough etiquette, how they should cough, shouldn't cover their mouth and nose while coughing. Do not cough directly into the air. Limit patient movement outside the room. Then patients to put on masks when leaving the room. Then what? Single. Airborne precautions. Then we have single negatively pressured room. Negative pressure. The room should have negative pressure, like theaters normally. Doors to remain closed, just like we do in theater. We put on N95 or PEEP mask. Patients about respiratory hygiene. Patient to put on surgical mask when leaving the room. Port of entry, maintain integrity of the skin and mucous membranes. Prepare position for tubing, etc. May prevent injuries and skin break. So always ensure maintain integrity of the skin. Of course, do not have, for you as a healthcare provider, of course, shouldn't have like lacerations or cuttings, so that you don't get infected. So you turn and dispose debilitated, turning and positioning of debilitated clients, those clients who can't turn on them for themselves, who can't do it, so they should be hand and positioned appropriately. Ensure personal hygiene for the client. Dispose of contaminated syringes. They tell you do not want to recap. Normally do that. Immediately, of course, after using. Do not recap. Go and dispose it within the safety box. Proper handling of catheters and urine sets. That should be taken while collecting and handling specimen, blood, urine, CSF. So, the susceptible breaking chain of infection for the host, we're not going to eliminate the host, so we must protect the susceptible host. So protecting the normal defense mechanism by regular oral hygiene, maintaining adequate water intake. So you have to keep your immune system, up and working. Encouraging deep breathing exercise, encouraging proper immunization of children and adults, so that we develop herd immunity. Maintaining the healing process. So how do you maintain the healing process? Remember, factors which affect wound healing or healing per se is nutrition. So we need to take balanced diet. Appetite of the patient. Patients must be eating well such that their immunity is boosted. Helping the client to identify methods of stress relieving, since stress can also interfere with immunity. So we must be finishing. Standard precautions, the standard precautions at least, or what we call universal precautions. Those are practices in medicine of avoiding contact with patients' bodily fluids by means of wearing of non-porous articles such as medical gloves, eye goggles or goggles, and face shields. Those are universal precautions. So the practice was introduced in 85 to 88. In 87, the practice of universal precaution was adjusted by a set of rules, now known as the body substance isolation. Under universal precautions, all patients were considered to be possible carriers of blood-borne pathogens, which is true until proven otherwise. All patients are potentially infectious. So pathogens follow into two broad categories. They can be blood-borne, carried in the body fluids, and airborne. So under standard precautions, you have hand washing, gloving, gowning, and then masking or protective eye wear or eye goggles, and then the cap. Then shoe covers, there are those things you cover, put on the shoes. Some of these you already know, hand washing. So a standard precaution defined as a set of precautionary measures, including good hand hygiene practices and use of protective barriers, routine patient care carried out by the healthcare provider. We normally do this. Putting on gloves before you draw blood from the patient, putting on a mask if you go to a TB ward, putting on an apron if you're in the delivery room, prevent liquor from splashing on you. Okay, so those are standard precautions. Hand washing, you don't need to define hand washing, is one of them. 5 moments of hand washing. Before touching a patient, you need to wash your hands. Before doing a clean or aseptic procedure, after body fluid exposure, you expose it to CSF or amniotic fluid or acetic fluid, any body fluids there. After touching a patient, then after touching patient surroundings, tables, beds. This one, you know how to wash hands. We are not in the UNOSC. In a practical exam, of course, they tell you to demonstrate how hands are washed. Then masks, types of masks, surgical mask, N95, gloves. Then you need to know the proper gloving technique. This one I need to demonstrate. Gloves can be non-sterile gloves, are suitable for most situations when contact with any body or body substance, mucus, non-intact skin is anticipated. Then sterile gloves, they are worn for surgical procedures where asepsis must be maintained. Then we have eye protection. Types of eye protection, you have this chin length plastic face shield. Then you have this goggle node. Then you have protective clothing like plastic apron, which we normally would be these Macintosh or plastic cavera. They normally should be fluid resistant. Are we still on? Hello?
We are on.
Our thing is going to go off again. We shall join back again for only 15 minutes and we'll be done. Okay?
Okay. Okay.
So if it goes off, we get back on for only next 15 minutes. We delayed because of recording, but then managing injuries and exposure in healthcare. So standard precautions, you've gotten them.
And washing PPEs.
Yes, and washing proper personal protective equipment. Like what?
Gloves,
gloving, eye goggles or face shields, and then masks. So actually, it's a full question. Write short notes about universal precautions. Then another question, write short notes about standard precaution. It's been coming in medicine several times for those preparing for medicine and surgery. But of course, they also ask in Busitema and other IUIU, they ask you about these infection prevention and control measures. Then how do we manage